Hi, my name is Miles McGann, and I'm the CEO of Progressive Orthodontics. Today I'm here with my good friend, Dr. David Dana, our head instructor, and we are here today to talk about the Update 2018.
This year I selected to do the seminar on facial aesthetics and ortho. And I know it might sound like a broad topic, but the reason I selected this topic is most of what you see in ortho and ortho offices is people focus on making a set of straight teeth and give them a good bite. But the overall facial aesthetics kind of like falls into the background. And how many times we see beautiful straight teeth and faces that are not harmonious or in balance with the smile that the patient got or the teeth, straight teeth and bite that the patient got. So adding facial aesthetics to what we do in ortho, I think is paramount.
Yeah, I mean, I think what you're saying is that, taking a step back and look at what the patient actually wants. And I think, my father, who, Dr. Don McGann, who kind of started this whole program, we always kind of focused on the teeth and, the teeth. And I think the ortho specialty as a whole is so worried about class 1, class 2 and how the finish looks from the teeth. And what you're saying is, hey, let's take a look at what the patient wants, take a step back and look at it from that perspective.
Correct. Actually, during the seminar, I put a couple of title slides of how I interview my patients. Everybody knows when a patient comes into an ortho office or a general dentist like we are that do orthodontics, we all know that the patient wants straight teeth.
Right.
Most patients don't even recognize a bad bite.
Right.
But we talk about, oh, you want your teeth straight or your teeth are crooked, let's make them straight. But we never ask, hey, how do you like the position of your lips? Do you like to bring them back? Do you like to bring them forward? How about your chin? Questions about soft tissue and facial harmony that are pretty much ignored in most orthodontic questionnaires. If you don't understand what the patient expectations are, no matter how good your orthodontic treatment ends, it's not going to be successful.
The primary goal of an orthodontist or the primary goal of any dentist is to make the patient happy at the end of the day. And the patient needs to be happy with their look. And I think orthodontists, and general dentists who are doing ortho get so caught up in the mouth, they tend to skip over the idea of what does the patient going to end up looking like, and are they going to be happy? Because your patient's
Correct.
never going to know what a class 1,
Nope.
Did I finish class 1? They're going to know, do I look good?
Do I look good?
And
Exactly.
and so even if it's your first case, you still want to see, is this patient going to look good?
Correct. And one of the problems that we have to be able to see or visualize if the patient is going to look good or not is that cephalometric analysis that we use do not focus on soft tissues, and whatever they do about soft tissues, it really doesn't have the value of aesthetics. I will be discussing different soft tissue analyses, not only ours, but different soft tissue analyses that are out there in the literature that really does not give you the full story of how the harmony between bone, teeth, and cheeks, lips, and chin balance. I'm going to be talking about how to extrapolate some of the measurements we're familiar with from the skull to the face so we can get a much better or more in-depth evaluation of the facial aesthetics of the patient. So as we plan our treatment, we don't put the teeth where the SEF number says, because many times you do that and you end up with a face that suffers rather than gets better.
So in that answer, you had one little point in there that I know we've had discussions about, but I think most guys don't realize. You said what the literature says. And I think one of the things that, talk to me about your literature and how you have approached the update, not just this year, but for the last 4 or 5 years.
Whenever I write a lecture, I do a very in-depth literature review. Actually, I try to go as far back in time as possible. As we were talking a couple of days ago, there are some things in dentistry that become classics. And it doesn't matter if it was written in 1920 or if it was written in 1970, that's a classic and you have to study it and evaluate it and learn from it. So I'll try to go as far back as I can so I can get a broader view of what has been done, where have we gone, and where are we going.
Yep.
I review about 12 different cephalometric analysis work and the perspective of each one of the researchers.
Yep.
And as I was looking at everything that was out there, I really couldn't find a true aesthetic measurement that will tell me this is what's going to enhance the patient's facial traits.
Right.
Actually, a lot of very famous orthodontic authors tell you there is no cephalometric analysis that can really tell you anything about the face.
Right.
There is a couple of analyses that I actually going to be presenting at the update that are all about the face.
Right.
So I'm not going to move into, hey, don't diagnose your cases from the teeth, but we need to come and start diagnosing our cases also from the face.
Right. And during your, you've been preparing for this for what, about 2 years, because I know how your cycle works with these things.
Yep.
During these 2 years, you just mentioned you did a whole literature review. And so you're grabbing, as you're kind of doing a deep dive into this concept, you're grabbing concepts from outside of POS as well.
Yep.
Who else and where else did you go to learn things, to gain a perspective that has been useful as you kind of went into this?
As you say, this has been about a 2-year process.
Right.
And this is probably one of the most laborious seminars I ever have written.
Right.
A lot of work, a lot of effort. I actually had to go and interview your brother. I spent the whole afternoon with Grant.
Just for all you that don't know, my brother is a maxillofacial surgeon down in San Diego. He's also taken POS, so he knows POS as well, but does work with many of the very top orthodontists in the world. And so has a very interesting perspective. But you decided, not to get you off track, but you went down to talk to Grant. Why did you go talk to a maxillofacial surgeon about an orthodontic topic?
Here's the reason. Maxillofacial surgeons, in order to provide good results, they have to have a good orthodontic setup.
Yep.
The orthodontic setup has to be not only planned on how I'm going to make the teeth bite, but how am I going to enhance what the patient has, make the patient look by far better from what they have. Grant is very knowledgeable about orthodontics. He actually sat at the lectures, he took the whole series, he understands orthodontic setups properly, but he takes it a step beyond. I've always been puzzled with how do they set their facial aesthetics to end up with great results, and that was the main reason I went to.
Right, and I know my brother's practice, obviously I know him very well. His practice is based upon facial design.
Yep.
Even the title of his practice name is McGann Facial Design. And so I know, from the surgeon's perspective, that's all he worries about. How does a face end up looking like? So I think it was a fascinating decision to go talk with a maxillofacial guy who this is all his focus on, is the end result.
Yep.
And how they get there. Now, with that conversation with him, did you find, obviously you're going to be talking a bit about how surgical setups work and the surgical orthodontics. Talk to me about where you think that surgical orthodontics fits into the POS system.
We cannot ignore orthodontic surgery or surgical ortho on any type of orthodontic system.
Right.
We have gotten so used to think that we can correct anything with braces, screws, and a little bit of bone cutting that we have now tend to ignore the soft tissues. But we have to remember that the inside supports the outside. And if you don't place the inside in the right place, in the right space, the outside is not going to look good.
Right.
During the update, actually, I show a couple of cases where the cases were treated to almost perfect cephalometric norms. That's when I used to do everything based on cephalometric norms. And to my surprise, I deterred from the facial aesthetics of the patients and made patients age dramatically in 2 years just by not looking at the outside. See, we need to have a good foundation to have a good facade.